Welcome back. It's still Mama's Nest, proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. My name is Fome Ejumudo, and I still have with me here my guest, pediatric nurse, Nurse Faith, and also first-time mom to an 11-month-old beautiful baby, Sarah. Thank you, ladies. Thank you for hanging in here with me. We've been discussing immunization. It's so important to give our babies these vaccines because it protects them from a future occurrence of an infectious disease. So it's very, very important that we take it very seriously. But why do I feel like after about 1 year old, the baby's getting to like 2 years, like we're running out of vaccines, there are no more vaccines to take? Because I can say from experience that the last time I went to get a vaccine, they said they were not available and they were pricey.
Okay. Yeah, after a year.
After a year?
There are still vaccines that the baby needs to receive, which are, at 1 year, we give the vitamin A, which is oral, is given orally.
The one they press into the mouth?
Yes,
okay, I know that
the
one.
vitamin A. The child also gets a booster dose of meningitis.
What does vitamin A protect against?
Cataract, retinopathy.
For the eyes?
Yeah, it's for the eyes.
For the eyes.
It protects the baby for retinopathy, for the eye not to damage.
Okay.
Yes.
Okay.
It's a disease of the eyes.
Okay.
So you get meningitis as a booster dose. You know, the child has already gotten that meningitis at 9 months.
At 9 months.
When he gets the measles, yellow fever, and meningitis. But at 1 year, it's repeated as a booster dose. Yes. Yeah, you give the child that. Then subsequently,
meningitis vaccine.
Yeah, yes. We call it Men-A.
Men-A.
Yeah, it's against meningitis. Meningitis is the disease that affects infectious disease of the brain, inflammation of the brain, membrane, and spinal cord.
So there are still more vaccines. When we started, you said even 5 years, 10 years.
Yes.
And how about the mom? Does the mom get any vaccine after birth? Don't we deserve some vaccines? Did you get any vaccination after birth?
No.
I know we take one at when pregnant,
tetanus, yes.
But after birth, did you get any vaccines?
No, I didn't. The only thing is when I went for the vitamin A, they asked me to drop 2 or 3 drops inside my baby's mouth, then I take the rest.
Okay.
That's what they
you got a booster dose.
Booster dose.
You got a booster dose. And Sarah, there's also this thing that happens sometimes when you go to get the vaccine, they don't have the vaccine.
But
and then they tell you
you can also get that vitamin tetanus for life.
That tetanus is just something I don't understand because the breaks in between them is very long.
Yes.
And then you tend to forget and you just move on with your life. You've had your baby and you didn't get the illness and everybody just tends to move on.
If you have gotten a live vaccination for
tetanus,
for TT, you don't need to get injections again during pregnancy. You're not supposed to be injected. You're not supposed to be vaccinated again. Okay. So that's just the benefit of it. Okay. But if you didn't get the life cover, you can get just 2 shots.
Okay.
In 1 month
interval while pregnant.
So the first dose, after 4 weeks, you get the second shot. After 6 weeks, you get the third. Then subsequently, then 1 year, you get the last.
That's the thing. That's why I always break it.
Yeah.
After 1 year, I've moved on with my life.
Told me about that.
Just like you said, you can as well set up your alarm.
I usually just
you'll be surprised, except you change phone.
Except you change phone.
You'll be surprised that day
it's a good idea
your phone
to
will
save
alert
it.
you. Yes.
To save it as
even some facilities will call. Like when facilities will call our mothers to remind them in case they've forgotten.
That's also important.
You call them 2 days to the vaccination date. You remind, you give them a reminder that your baby is supposed to get so vaccine at so age. Are you still aware of it? Some will tell you yes. Oh, thank you for reminding me.
Yes.
That day they will come.
Many mothers just forget.
Yes.
But then I was also talking about a situation where it's quite common where you go to vaccinate and then they tell you this and this is not available for now, or maybe like 3 is not available. bring the baby back on the next vaccination date
Same
and they
thing.
give the baby everything. Please, is that not an overdose of
No.
vaccines?
It's not an overdose.
And they're giving your baby like 5 vaccines at the same time?
Yes.
If a baby misses a vaccine now, there is nobody except the personnel doesn't know what he or she is doing. You first of all give the missed one. Just
The missed one.
Yes. You first of all
Just
give
like they did to my baby too
yes,
when we
okay.
missed.
that particular vaccine that the baby mixed, because these are different antigens that you're introducing. You will cause more harm than good to the child
To the
by giving
child.
two different ones that the child's supposed to get, you understand, at different intervals. So you
it's
don't
safe.
bring it together because the child missed the previous one.
The previous
You
one.
understand? So you
Okay.
first of all give
You
that
give
one
the
that
one
was
that was
missed.
first.
Yes.
And then
And
give another appointment
Yes, for the
for
next
yes.
dose, for the
okay.
next schedule.
Okay.
You understand?
Okay.
Yes.
Okay, I understand that. Because it's always a cause of worry and concern for me when
And if
they're
there's
telling me
if you were the cause, the facility was the cause, the reason the baby missed that vaccine, the gap for it shouldn't be that much.
too long.
Especially highest a week interval. You just
okay.
give them the next appointment. So please come. But if you know you can't wait as a mother, there are many places you can
You
get
can try other
vaccines. You
places.
go there, you pay. You get
Okay.
yeah.
Okay. So Sarah, you
if
also
can't pay, there are
mentioned
government parastatals are also
that
giving
can
it
give
free.
free.
It's free of charge. So don't be scared about the money. Get your child vaccinated.
It's very important. It's very important. Sarah, I remember you mentioned that your baby was feverish and you were scared. How long did it last?
48 hours.
Okay, so after 48 hours, it
Yes,
cleared.
yes.
She was fine.
Yes.
After you
48
administered
The
the
paracetamol.
paracetamol.
Yes.
So also, what's the normal range for this reaction to last?
Yeah.
And when should the mother get worried at what's going on or seek medical advice?
Within 24 hours to 48 hours, all these things are supposed to be resolved. At most 72 hours. If peradventure it didn't stop, just take your child to the hospital, take to the pediatrician or to your healthcare provider. Let them know, because there are other things that it might not be the vaccine this time around that it has extended. There are other things that can interfere
With the vaccine?
Yes.
Okay.
You understand? So they had to do some investigations to find out why this is still.
Why the baby is probably still running a fever.
Exactly. It could be that the baby had malaria before that was not detected before the vaccination, before the baby got the shots. So the vaccine now triggered everything.
Okay, triggered
so
something
when
else.
a test is being run, the baby will be treated and she'll be fine.
All right. And you know, sometimes they tell you don't rub the area, don't rub the spot, don't rub it, don't you know, don't tamper with it. But how can we take care of that site where the baby was injected? Sometimes you notice it forms like a lump, it's painful, the child is irritated when you go near that area. How can we take care of it, apart from giving the baby, obviously, painkillers?
Okay. Naturally, or the vaccine already forms the lump. So you applying pressure there.
Should press with hot water?
We make it to be more severe. It worsens it. So that's why we advise for you not to tamper with the site.
Okay.
Just like I said, if you see that the swelling is too much, or you can report back to the hospital, or you use what we call tepid water, just lukewarm water.
Lukewarm.
Just damp around the sites, not on the sites. Do not
Around.
do not press, do not apply pressure on it, just around. It will just help the baby to relieve the baby of the pain and relief.
Okay.
You find out that sometimes after doing that, the baby will stop crying if it was a crying wound.
Okay.
The baby will feel relief, some will sleep off and everything.
All right.
Then you give paracetamol, just like I said before.
Did you ever get to a point where you had to like press or massage or anything?
Yes, I got to a point where I had to press, and mistakenly I pressed on the
Oh, you pressed on the side.
Yes.
It's
turned red.
tempting.
Yeah,
It's
It
tempting.
turned red. The next day, start having rashes.
the rashes, you
I had
see.
to go back
Yeah,
to the
some people
healthcare
You have to go
center.
back.
Some women will even go and apply shell butter,
Shea butter.
and some concussions. No, it's not advisable. It's not advisable. It will make, just like I said before, it will increase the swelling more because it doesn't need pressure. Even we, the vaccinators, we don't, after you just apply little pressure to constrict the vessels from bleeding. That's all. Once you remove and the child is no more bleeding,
Yes.
you just leave, or you just put a strap. You just strap
the
the
plaster.
place. Yeah.
You know, even an experienced mom didn't know that you don't actually dab, you don't tamper with the site where the baby has been vaccinated. And I think that you need to give us an actual demonstration of how to do it. And we'll go into that right after we take this short break. Please don't go anywhere. You don't want to miss this. We'll be right back. And we are back. It's still Mama's Nest, powered by Cousin's Baby. Nurse Faith here is ready to give us a demonstration on how to actually take care of your baby's vaccination sites, how to dab it. Please take over. Take over at this point.
Thank you very much. So let's assume this is the site where the baby was vaccinated and there's a swollen here. So you use your clean towel. Yeah. But
So
for demonstration purposes, we are using this. You just use...
With I think you said...
you damp it in a tepid
water.
Lukewarm water.
Lukewarm.
Then you damp around just to help relieve pressure and pain of the vaccines on the child. And this is the site. You don't do this. You don't press on. Yeah, you don't apply pressure on the site itself. You understand? You do like this. You do like it to help the child. Though he or she will cry, but after doing it, there will be a relief.
A little bit of relief.
And you're also trying to avoid infecting the site as well, because touching it will, you might not know.
Or maybe even imitate
Yeah, our hands are full of germs. It will get infected, and before you know it, it will be generalized, and every that will start treating for infection and the place.
Sarah, take notes for baby number 2.
You can also, if there is a running tap, you can just put up. This is where there is no running tap. You can just put it on a running water. Because running water is also tepid. So just run on it and you bring it out, and the baby will also feel relieved. Yes, that's all.
Thank you for that demonstration. How about, are there any instances where there's like an overdose? I know different babies react differently, and you know with vaccines there's a universal amount that's given to every single baby. But is there any such thing like an overdose? Maybe a mom forgets that, okay, I've given my baby this vaccination. And I also understand that the nurses always sign that it's been administered. But do you have any cases of an overdose, and are there any side effects?
That's why we have a tracker card.
The tracker card.
It should be documented that this child has gotten this vaccine. If the mother forgets and brings back the baby, it's the duty of the nurse or the vaccinator to go through the card and see if this child has gotten this vaccine before or not. But that kind of mistake usually occurs where there is no record. If maybe they forget, or some mothers do forget their cards at home while coming, but in your facility, there's also a record. If it's not recorded in the card, it should be recorded in your own record.
So the chances that there will be a mistake will be very slim.
Very time I forgot my tracker card. The nurse asked me to go back and bring it.
I'm sure the nurse was like, how will you forget your card?
You understand? Like, it's very important. Why will you forget such a thing? And even today, I just remembered I was coming to a show talking about immunization. So I was like, where is the card? I was trying to look for the card. Let me just know where it was, but I couldn't find it. And I called my husband, and exactly where it was where he said it was where I found it. So I like to advise that men too should try sometimes to follow their wives to the hospital. It's really emotional for us because most times when we go to the health center for vaccination, and immediately they see my husband, nursing father, please come.
Oh.
We don't wait at all.
Oh.
So it's really very emotional for us, and I advise that men should also try, follow, support.
Yeah, it's
go
very
with her.
key.
It might not be every
support,
day, might not be every time, but once in a while.
I think men these days are really trying, because a lot of couples come together yeah, with their children. And like I said, in my organization, we don't send mothers back home because they forgot their tracker cards. You just, because you need to have your own record. Of course, the record shouldn't only be in the baby's card. You understand?
Okay,
so in that case, you go back to your record, you check when last the baby was vaccinated, and the vaccine, age. Yeah, and the vaccine gotten. You can ask the mother, how old is your child now? So that will help you
to track it.
Then you know the next vaccine to give, and I advise them to come with it when next coming, or if they can bring it the next day, so that anybody around will record. And it will help.
So all these vaccines really, can they also trigger any other reactions in the baby? Say maybe something like a rash around the body, on the face, or any other parts of the body, or any other symptoms at all?
Yes, they can.
They can trigger.
They can trigger. Just like I said before, like there's inflammatory process. It can come with rashes. You know, individual differences.
Yes.
Some babies come down with rashes. I've seen a case whereby after a week of vaccination, the mother brought back the child. It's even an international woman. It was Oyibo.
Oh, I see.
So she was like, oh, look at my baby's body. This, I started noticing it after the immunization, you know. So we just advise her that is one of the mild side effects.
So it's nothing to worry about.
It's nothing to worry about. You can just give them any dermatology cream.
Any topical cream.
Yeah, you give them for tropical appliances, and then just go and apply on it to cancel the woman. And but if it persists, then she will need to be referred to a dermatologist. We need to do more investigation.
I'm happy you mentioned somebody from abroad, because sometimes you take a vaccine here, and you know now it's like jackpot season, everybody is relocating. If a mother takes a vaccine in Nigeria and she has to relocate to, say, America or somewhere else, Europe, you know, they give vaccines here based on the illnesses that are prevalent here. So how does she balance the vaccine? Do they need to give the complete dose over there? Is there no need anymore for the complete dose to be administered? How do you manage that?
You know, the vaccines are given, just like you said, according to the illness prevalent to that particular environment. So they will go, if they are going there, they are relocating, they will go with their cards. The tracker card will enable the people over there to follow up. Okay, this and this has been given. Just like we too, we do have mothers who traveled abroad to give birth. When they come, we will know the ones that have been given and the ones that are going to get here. So those diseases that are not in that place,
they don't need to take them.
Nothing will expose you to it. Yes, it's only the ones that you know that this child will be exposed to this disease one day. So you just immunize and give them immunity against that.
And Sarah, I don't know if you've heard about a myth that vaccines make babies weak. Have you ever heard that?
I've heard about it.
And we'll also talk about the negative, you know, there are so many people that don't believe in vaccines. So we'll talk about that, but what do you think about that?
I don't think it's true. It's true. I don't think it's true. Like she said earlier, like the vaccines are made from the foreign bodies. So I think the baby will only react to that
temporarily.
It doesn't mean that it's the vaccine that is making the baby weak.
And it's not a long-term thing anyway. It's not a long-term thing.
I don't think it's true.
When we started this discussion initially, you mentioned that there's still some people that don't believe in vaccines. There are people that don't take it. They don't have any faith in it. But I think it's also prevalent in like the north.
Yes.
But are there people, have you seen people, have you come across any patients that...
Yeah, there are people in the remote areas. Yes, they've not really been well informed. They are not sensitized about these diseases and the vaccines. You know, immunization, when they are being well informed,
yes,
they will understand what it means. To them, they feel you want to harm their child.
You want to harm their child.
You want to give their child what they don't know. Anything that happens to them, they will not say it's as a result of that.
The vaccine.
That vaccine that they came to give to my child. It's ever since this child was vaccinated that this is happening, which is not true. It's wrong. You understand? So I advise that mothers who are in areas where maybe there is no internet or
there's no quick access to healthcare facilities.
Yeah, they should also be informed and explained. They should be educated to know what immunization is all about. That's why, especially in the northern part of the country, you see a lot of deformities.
Especially polio.
Yeah.
Yes. Like for me, I was born and brought up in the north.
Okay.
So we have a lot of them around us. Polio, especially. Polio, cholera, and the likes, but the most prevalent one is
because
polio.
Of their weather.
Yes.
You know
the weather is hot.
These organisms
thrive
in hot weather.
Yes.
Wow. So we have a lot of them around us, especially polio. You see my mom, she will be chasing us to go out from them.
And they usually end up...
because it's highly contagious.
Yes, it's highly contagious.
Oh, that polio?
Yes.
Yes.
Wow.
It is a viral disease.
So I didn't even know it was contagious.
They don't really believe it.
They don't believe in it. I think
but now that they're
kicking against polio, I think it's even
and they're
stronger
complying
in the north.
to the vaccination process.
Yes.
It's getting reduced.
And sometimes I see these local government healthcare officials taking like a cooler box.
Yeah, that's what they do.
Administering
outreach. You go to them, meet them at their doorposts. You understand? Meet them at their doorsteps.
But if the baby had taken the polio vaccine earlier, is it safe to take it again?
Yes,
it's still safe.
It's still safe. It's a booster dose.
It's okay.
You won't harm the child.
Okay.
Yeah. And that's why I think the awareness is more in the northern part.
In the northern part, it is.
Yes, there's a lot of awareness.
It is, because I know there's a program, Kick Against Polio.
Yes.
Yes. I also heard a story where a lady was saying that she met somebody who was giving out vaccine. She claimed she was giving out the vaccine. She asked her, what vaccine is it? And she couldn't say the name of the vaccine. And then she went further to probe that, where are you from? She couldn't really give any tangible answer to her question. And she was like, my baby is not around. Because the lady was asking for the baby. Where is your baby? I want to give your baby a vaccine. You know, and I'm happy that she went ahead to, to probe the woman. Because she was like, she didn't look like, she didn't come with anybody else. She was alone. But I know those people usually move around in groups.
Yes, I like what the woman did.
Yes.
That particular person is a suspect, because in outreach, one person alone cannot go. You go in pairs or in threes.
In threes.
You understand? There is a vaccinator, there's a supervisor, maybe a higher person who supervises how everything is being done. And there's somebody, maybe a Yoruba person, for instance, in Lagos,
just someone to
depending on
or to speak the local
that will
dialect.
Exactly to the language that they will understand better, to explain to them so that they will be able to comply. You understand? So one person alone, and you're not with any evidence of vaccination. So
suspicious.
A mother, you should also be
very vigilant. Ask questions.
Yes. You don't allow strange persons, random person walk into your house and tell you, okay, I am here to vaccinate your baby, and you just release your child without questioning to know, okay, what kind of vaccine is this?
Where are you from?
Where are you from?
Because I also know those people, they wear like a vest over their clothes. Like
yes, that's an identification.
That's why I said earlier that I don't really believe in taking vaccination from the people taking it around.
Okay.
I have a belief, my own belief is go to a public health center. I don't even like the private.
At least
because that public health center, they will, those vaccines that maybe there are 5 jab. Am I correct?
5 in one.
You know, in the private, they will tell you until they see like 3 to 4 children. But at public health center, people are always around.
People are always available.
People are always available, so your child gets
and I think that's also why they do vaccines, vaccination days. They give it out in batches. They say our vaccine days are Thursdays, so that everybody comes in and then they give.
Open
so you can open and then give it out.
I think mostly it's only BCG and measles that they do that they will expect a good number of children before they can open. But other vaccines you give, there are single doses. You understand? Most private organizations have single doses. They don't wait till they see 10 babies to open.
Yes.
So you just come, they give only that one is for your child, and it's safe.
It's safe.
You understand?
Awesome, ladies. We've been having such an insightful and informative session on vaccination, which is very, very important for your baby. And before we round up the show, I just want to mention also that the card is very, very important. Don't play with your card because your baby will need it later on in life, maybe for, I think, maybe travel purposes,
for school.
For school.
Yes, most schools now you have to bring your immunization card for record purposes.
Yes, like when I took my baby to the crèche, they asked for it.
They did ask for it. So it's very, very important. Please keep your immunization cards safe. Awesome, ladies. It's been such an insightful and educative discussion we had here on immunization. I certainly learned one or two things, and I'm sure that you took one or two things out of this discussion as well. And before I go, I won't forget to mention that your baby's immunization card is very, very important. I didn't know. I used to play around with it, but after they told me that your child might need it later on in life, maybe when you're applying for travel purposes,
education purposes,
for school, and maybe you're applying to a crèche, they will ask you for your child's immunization records. So it's absolutely important that you keep it safe. Don't forget to send in your questions. Ask us any questions at all. We'll be excited to answer them. Leave it as a comment or send it in as a message to any one of our social media handles now scrolling on your screen. Don't also forget that you can download the Mama's Nest app. It's available for iOS and for Android. On the app, it makes it very simple. You can simply download the approved list of recommended vaccines that you need to give to your baby. It's been an awesome one on the show, and we will see you next time. Mama's Nest is proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. See you next time, Mom. You can do this. Bye.